Okay. Good afternoon, everyone. My name is Rebecca Saltzball, and I'm with the Christopher and Dana Reeve Foundation. I would like to welcome everyone to today's webinar on domestic violence. Thank you all so much for joining us. Before we begin, I would just like to take a moment to introduce you to our presenters, Cynthia Amadeo and Sarah Eldridge from Barrier Free Living. Cynthia is a licensed mental health counselor who specializes in the intersection of domestic violence and disabilities. Her current role is as Barrier Free Living's Chief Program Officer, where she oversees all programming in the agency, including Freedom House, Secret Garden, and Barrier Free Living Apartments. Cynthia began as a children's counselor at Freedom House and has since held several leadership positions in the agency, including Coordinator of Family Services, Director of Family Services, and Director of Social Services. She regularly presents at domestic violence and trauma conferences nationwide to spread awareness of how domestic violence impacts people with disabilities. Prior to working at Barrier Free Living, she counseled children infected and affected by HIV/AIDS, as well as survivors of the 2001 World Trade Center attack. Cynthia received her Master of Education and Master of Arts from Teachers College at Columbia University. Sarah Eldridge is a licensed Master Social Worker and the Assistant Program Director at Barrier Free Living's Secret Garden program, where she provides trauma counseling to domestic violence survivors with disabilities. Prior to this position, Sarah was a social worker and the Assistant Director of Social Services at Barrier Free Living's Freedom House Shelter. She has also worked with youth and alternatives to detention and incarceration programs, student veterans, and crime victims. Sarah received her master's degree from Silberman School of Social Work at Hunter College and is currently a trainee at the Institute for Contemporary Psychotherapy's 2-year trauma program. Just a reminder that today's webinar is the first in a 2-part series. The second webinar, which will cover the unique challenges a person with a disability faces when in an interpersonal violence relationship, will be held on Thursday, June 4th. You will be receiving an email following this webinar, a follow-up email, and that will contain a registration link to the second webinar to be held in 2 weeks, in case you haven't registered for that yet. You will also be getting a post-webinar survey to complete, so we please ask that you take a few minutes to fill that out. We would greatly appreciate it. I would like to thank Cynthia and Sarah so very much for presenting today on such an important topic. With that, I will now turn the webinar over to them.
Well, thank you for that wonderful introduction. This is Cynthia Amadeo, and as stated, I'm the Chief Program Officer at Barrier Free Living. So just a few things about myself before we get started. My pronouns are she, her, hers. I am white, able-bodied, and hearing. So as we give this presentation today, I want to recognize that we're talking about the intersection of DV and disability, and I'm not the expert, as I myself do not have a disability, but speaking as an ally and from my experience in the field. So a little bit about Barrier Free Living and who we are. We are located in New York City, and we started back in 1978 as a federally funded research and demonstration project, first known as Project Outward Bound. Through the years, we've gone on to work with thousands of people with disabilities and launched several successful award-winning programs and became a leader in working with survivors of domestic violence with disabilities. Currently, we have 3 programs. We have Secret Garden, which is a community-based domestic violence program for people with disabilities. And there we provide counseling, support groups, occupational therapy, and case management services. We have a hotline for both hearing and the deaf, a video phone. So if anyone's interested, you can go on the BSL website and you can find our hotline numbers there. Freedom House is a domestic violence crisis shelter for people with disabilities and their families. We offer services to both single individuals and families, and we provide case management, children's services, counseling, and support groups there. We also offer supportive housing, and that's permanent housing for people with disabilities who were formerly homeless, and we offer services for both families and singles. And there, again, we provide counseling, case management. We have a children's learning center, and we offer a ton of community events. So today, we're going to be speaking about domestic violence. We're going to start by going over what exactly domestic violence is. We'll be reviewing some of the types of abuse that people with disabilities experience. We're going to describe a little bit about caregiver abuse and caregiver privilege, and some co-occurring conditions such as depression and substance abuse. I would like to mention that some of the topics that we're just going to discuss today are difficult, so a bit of a trigger warning. If for any reason you feel that this is difficult for you, please feel free to step away. As mentioned, this is recorded, so you can come back to it when you feel a little more comfortable and safe. And you can always reach out to us through our hotline at Secret Garden or visit our website at bslnyc.org.
Great.
So now
Thank
I'm going to
you,
give it over to
Cynthia.
Sarah.
Thank you. I'm Sarah Eldress. As mentioned in the introduction, I am a social worker, and I'm also the assistant program director at our Secret Garden program. I am able-bodied. I'm white. I use the pronouns she and her. So like Cynthia, I am speaking from my position as an advocate, as a counselor, as someone who's been in this field for a while, but I also want to make it clear that I do not identify as a person with a disability and that I can't speak for people with disabilities. So before I give you our definition of domestic violence, I just want to take a quick moment and see, if anyone wants to chat in how you would define domestic violence. Feel free to just send it into the chat. Any thoughts? Okay, well, we can move. I'll move into our definition, but feel free to add any comments in the chat if there's anything that you feel that I'm missing. So the definition of domestic violence: physical or mental abuse in the home. Great, folks are starting to answer. So domestic violence is a pattern of coercive tactics that can include physical, psychological, sexual, economic, and emotional abuse, perpetrated by one person against an adult, intimate, or interpersonal partner with the goal of establishing and maintaining power and control. And so power and control is really the key element of what makes something a domestic violence relationship, as opposed to a situation where there might be mutual aggression, mutual violence. In domestic violence, there's an unequal balance between the perpetrator who's trying to maintain power and control over the survivor. Domestic violence can occur in all kinds of relationships. It includes married couples, people who are dating, people who live together or have children in common, same-sex partners, people who were in relationships, teen relationships, and also, and particularly important for the topic we're discussing today, is that it can include relationships between adult family members, so that could be siblings, parents, and children, and also by caregivers. So as we think about domestic violence for people with disabilities, it's important to keep in mind that someone who may be providing care to someone, for example, you're living in the home of a sibling who is helping to care for you, they can be perpetrating domestic violence, right? They can be abusing you and using these tactics of power and control. And we'll discuss that a little bit more in detail, but just something to keep in mind as we're going through this presentation today. I do include a statistic on this slide that women with disabilities are 40% more likely to experience intimate partner violence, especially severe violence, than women without disabilities. So again, that just speaks to the importance of discussing this topic, because we know that women, and of course men, although there's fewer statistics, fewer research, that they are more vulnerable than people who don't have disabilities. So I just want to show for a moment this power and control wheel. Some of you might have seen it before. I really like this because it's this nice visual that goes over all the different tactics that abusers use. So that can include emotional abuse, isolation, economic abuse, intimidation, all the different tactics that folks use. We're going to go into those tactics in some more detail, but I did want to point this out. There are many, many different power and control wheels for teenagers, for immigrants. There's for disability. If you Google it, you can find it. But I've often found this very helpful in my work in showing it to survivors because it really helps them understand how complex the abusive relationship can be. So I just want to talk a little bit about some of the myths that we see when we think about domestic violence. Some of these are messages that we may get from society, from our friends, sometimes even from advocates or folks who work in professional fields. So the number one myth, of course, is that the victim can leave anytime they want and that they're actually choosing to stay in that relationship. Of course, that's not true. There are many complicated reasons why people can't leave, whether that's physical, economic, maybe they have affection for the person they're in the relationship with, but it's not as simple as just packing up your things and leaving. The myth that physical abuse is quote-unquote real domestic violence, although that's certainly a component. All different types of abuse are valid and something to be taken seriously, so that can include emotional abuse, verbal, economic, sexual. In fact, many of the folks I've worked with have said that the verbal and psychological abuse is more affecting to them because of how it affected how they saw themselves, how they felt about themselves, how they felt about the relationship. The myth that the victim provoked the abuse, often there's an idea that, well, she must have done something. You know, why didn't she just make the dinner that he wanted, right? Why didn't she just stay silent? She knows that he gets like this. All different victim blaming tactics, and it's really important that we really step away from that, that we acknowledge that because of the inequality and of the power and control, because of the imbalance, that the abuser is the person who's responsible for the abuse. The myth that men and members of the LGBTQ community don't experience domestic violence. Unfortunately, it's still very common to assume that it's just women, and even though women make up the majority of survivors, men absolutely can be abused. They can be physically abused by their female partners, emotionally. Female partners may use children against their male partners. And of course, LGBT couples can have domestic violence relationships. So it's really important that as we're working with folks, as we're assessing for domestic violence and we're advocating, that we be alert to these dynamics and know that they can occur in all different types of relationships. And finally, the myth that nice guys can't be abusers. We often see this idea, you know, that, oh, he's such a great person, he's such a great guy, he's a great friend, a great father, and this idea that how they present in public may not always match what's actually happening in the home. And so again, that's really important that if a survivor is telling us about the abuse, or that we know someone who's experiencing this, that we recognize that just because someone presents one way in public doesn't mean that they're not abusive in private. Okay, so I'll turn it back over to Cynthia.
So now we're going to go over the types of abuse. Sarah started talking about some of them. But the types we're going to be going over right now is physical abuse, sexual abuse and incest, psychological and verbal abuse, economic abuse, and medical. So physical violence. Like Sarah mentioned earlier, that's typically the one that we think of most frequently when we think about domestic violence. So physical violence is the intentional use of physical force with the potential for causing injury, harm, disability, or death. Some examples of physical violence include hitting, slapping, biting, strangulation, and use of a weapon. So I mentioned that physical violence causes injuries. Some people heal from those injuries, and some people have long-term consequences from those injuries, especially if you can't get immediate medical attention or treatment. So we recognize that in the population that we serve, there are a number of people whose disabilities has been a result of physical violence. So for example, it could be a brain injury from being hit in the head, chronic pain, especially if an injury wasn't been able to treat it. So for example, if you have a broken arm and that arm can't get treated, that can cause long-term physical pain. And we do have people who have lost their vision and their hearing because of the abuse. Sexual violence and incest is also very much part of domestic violence. I want to be clear that this is something that's motivated by power and control and domination. It's the most intimate way that you can have control over somebody else. It's when you have sexual contact with someone who's unable to consent. So there's many reasons why someone can't consent or is unwilling to consent. So it could be due to an illness, due to disability, maybe they're intoxicated, could be they're unconscious, maybe they're asleep, or they're a minor or child and unable to consent. This includes inappropriate touching by a caregiver while changing or bathing. So very frequently we hear about caregivers touching people inappropriately. And when someone tries to advocate for themselves and say that this didn't feel comfortable, it didn't seem right, a lot of times those folks aren't listened to or heard or even believed because they're told, oh, well, they're just doing their job, or that's just the way it is. That's completely untrue. So I definitely ask those who are on the presentation today that if someone is talking about feeling comfortable when a caregiver is caring for them, listen to them, believe them, because there may be something going on that's inappropriate. I also want to mention forced prostitution, that these are things that are happening both in the home and outside the home. So people are being forced into providing services that they don't feel comfortable doing for money. And there's also a stereotype and a myth that we often hear about, that a good wife gives her husband sex whenever he wants, that she has to be available at all times. And if you're married, you can't possibly be raped. That's completely untrue. It's very much possible to experience sexual assault even though you're married. I'm going to move on now to psychological and verbal abuse. This is one of the most common tactics that we hear about, and people often experience this for extended periods of time. And when they come to us and start talking to us about the experiences that they've had, they realize sometimes that they've been going through it longer than they even realized. And it usually starts with the psychological and verbal abuse. I noticed someone in the chat box earlier talked about gaslighting. This is a newer term, and it's very much part of psychological and verbal abuse. It's manipulating someone so they question their own reality. So for an example, we've heard of people where the abuser locks their survivor outside the home and then blames the survivor for leaving her key inside. So the person left, the door was locked behind her, and then the abuser is saying, no, it's you. How can you do such a thing? How can you lock yourself out of your own home? How could that happen? Meanwhile, they did nothing wrong. Some other examples is humiliating someone or controlling what they can and cannot do or say. So for example, making fun of them in public, name-calling, putting them down. Sometimes it's making threats to them. So it could be both verbal or not verbal. So hand gestures are a way of making threats. And sometimes there are things that go on within a relationship that the outside world just wouldn't recognize. That seems like normal conversation. But the survivor in that situation knows it's a threat. So, for example, we have some cases where the abuser might say, all right, I'm coming home tonight. You know what that means. The survivor knows what that means. That means that she's going to have a difficult evening. But without that context, that's just a normal conversation of, see you later. Could be cursing at the person, which is often what we think about. Also, sorry, my slides just jumped.
No,
I don't know what happened. There we go. We're back where we should be. Okay. The good things and the bad things about technology. Okay. So we were at cursing. So cursing and putting someone down. Could also be withholding information. So, for example, we see this often in the school settings or in the medical setting where the survivor is not given the full amount of information because, for example, if you're deaf or hard of hearing, maybe the person who's hearing will only talk to the abuser who's hearing and leave the person who's deaf out of this conversation. Or if you're in a medical setting, only talking to the caregiver without talking to the patient themselves. So minimizing, denying, or blaming. We often see this a lot with pain, for example. So saying to someone, oh, you're really not in that much pain. You're making it up. You just can't be, particularly after an injury or a violent episode. Another example is isolating the person from friends and family. Right now, in the society we're living in, everyone is feeling isolated due to COVID. But more than ever right now, people are feeling even more isolated due to the pandemic. So they can't go outside for whatever reason, especially if you have an underlying medical condition. So we expect that there is a lot of violence going on in the home, and people who are experiencing abuse are experiencing even more isolation that they normally would. Because the people who are normally going into the home, such as caregivers, maybe they can go out to the schools or the medical providers or see other service providers, such as DV service providers, where they normally couldn't go. So the isolation is even more pronounced right now. I also want to talk briefly about technology abuse. So if the abuser is checking your video phone, your email, your text conversations, right now we're really relying a lot on technology to communicate with the outside world. If your abuser is not allowing you to utilize technology, then that's another way to isolate the person. Another form of abuse is economic abuse. I saw some people in the chat mention that they weren't aware of this. Yes, and it's a huge issue that we are dealing with on a regular basis. So some examples are withholding money for necessities such as food or medicine, impairing the ability to earn money. So for example, not letting the person go to work, or in other ways, maybe not as explicitly, maybe taking their car keys or hiding their car keys so they can't actually get to the workspace. And what sometimes happens is people end up losing their jobs because they end up missing too much work or showing up to work late. Taking people's benefits, such as their public assistance or their Social Security benefits. We often see abusers opening accounts in the victims' names or opening credit cards in the victims' names. We have had many people come to us, and when we do their credit checks, because that's an important part to finding housing, they realize that there's cards in their names, bank accounts. We even had someone who had a whole business in her name and had no idea. And another way is taking the victim's income, such as having themselves named as the payee. Once that happens, it's really difficult to get the person off as the payee. So that's a very serious offense. And then if they are the payee, not giving them access to the money as agreed upon. And right now, we are receiving reports that abusers are taking the stimulus checks and not giving it to the victim. We also have seen reports of victims having to ask permission to use their money or be giving an allowance, and that allowance is not sufficient for their daily needs. And the last type of abuse that we'll be talking about is medical abuse. This is a term that we rarely talk about, but it's very prevalent in the population we serve. So the most common we see is withholding medications or treatment as a way of controlling somebody. So not giving enough medication to someone so they get sicker, or withholding the medication, not withholding, or giving too much medication, so what we typically see is the person is sedated. Selling the victim's medication to earn money. We typically see this with psychotropic medications because they have a higher street value. We see damaging equipment such as wheelchairs, walkers, hearing aids, or not getting the equipment repaired. So if someone takes away the person's wheelchair or walker, then they're not able to seek safety or go to their appointments, further isolating them. We also see, unfortunately, service animals being abused and severely harmed. And this is done in the context of saying, I can do this to your service animal, I can do this to you, you're next. We also see using medications as a way to stigmatize or manipulate certain systems, such as child protective services. So, for example, if someone has a psychiatric disability, using that against them to say, see, this person is not stable to care for their children. Or using their physical disability to say that they're unable to care in a way that would be sufficient for the child rearing. And then just a general neglect or failure to provide adequate care, meaning not taking the person to a doctor's appointments or allowing them to go to a doctor's appointments. Again, the medication piece that we talked about, or it can be simple things that we, around our ADL skills, our activities of daily living. So if you take someone's wheelchair or walker away and they can't get to the kitchen, then they're hungry. You can end up starving someone. Or say someone needs to be changed and they soiled themselves. Leaving them like that for an extended period of time can cause physical harm to the person.
Great. Thank you, Cynthia. So now that we've had this great overview of the different types of abuse that can occur, we want to drill down a little bit to understanding the intersection between domestic violence and disabilities and how it specifically looks for folks who are disabled. So again, when we think about, just like we did with domestic violence, we want to talk about some of the myths that people with disabilities experience. And these myths are really damaging, particularly in the context of domestic violence, because it can really impact the kinds of help that they can that they receive, whether or not people believe them. So it's really important that we take a moment to discuss these and think about how they might be influencing us, right, our own biases. So there's often a myth that people with disabilities are not sexual, that they're not desirable, right, and that as a result they cannot have real sex or relationships. So just take a moment and think about that. If the myth is that people with disabilities cannot have real relationships, then if they're telling someone, right, a friend, an advocate, that they're being abused, the response they might get back is, but who would want you? Nobody would want to be in a relationship with you. You must be lying. You must be crazy to think you're in a relationship. They also get a lot of times those messages from the abusers, right? That I'm the only person who would want you, right? You're broken. There's something wrong with you. So you have to stay in a relationship with me because otherwise you'll be alone. The other consequence is if we think that people with disabilities can't be in relationships, that we're not going to provide them education around sex or relationships, right? Whether that's in school or in, different facilities that they might be living in or providers that they're working with. So a lot of times people with disabilities, particularly those with intellectual or developmental disabilities, but just any type of disability, a lot of times they're going to lack the language, the education, the knowledge about what are relationships, what is consent, what boundaries are appropriate. Cynthia talked a little about the boundary violations that can occur in caregiving, right? So perhaps someone's being changed or bathed and an inappropriate touch happens. So if people are not provided the education that that is not acceptable and it's being done in the context of caregiving, they may not know that it's wrong or be able to communicate to others that they're being abused. People with disabilities are often viewed as crazy and not credible reporters of their own life story. And this is true for people with intellectual disabilities or psychiatric disabilities, but honestly it can be true for any person with a disability. Unfortunately, if someone's disabled, we tend to generalize and just assume that that means that they are crazy, that they're incompetent or unintelligent, and so we discredit the story that they're telling us. And this can really be a problem when seeking help, making reports to the police, speaking to advocates. So we really want to be mindful of these myths and how they influence our own perception of the situation. I did want to, just as I showed us earlier in the presentation, the domestic violence power and control wheel, I did want to just briefly show this disability power and control wheel. Again, you can easily Google it and find it for yourself. But just to see that many of the tactics that apply to any domestic violence relationship shows up for people with disabilities, and that there are some unique factors that can influence people with disabilities. Just some statistics about domestic violence and disabilities. As we mentioned earlier, women with disabilities have a 40% greater risk of experiencing violence. And I do want to take a quick note and mention that I realize that these statistics primarily speak about women. As I mentioned earlier, of course, men, non-binary people, other members of the LGBTQ community can be victims of domestic violence, but unfortunately, most of the research and many of the statistics are still done primarily on women, and particularly for disabilities, there's not a ton of research being done to begin with, and when it is done, it focuses mainly on women. So I just want to preface by saying I know that this leaves out a big chunk of the population. Women with developmental disabilities have among the highest rates of physical, sexual, and emotional violence perpetrated by intimate partners and family members. The most common perpetrators are former or current intimate partners. An estimated 80% of women who have disabilities have been sexually assaulted. And it's estimated that between 70 to 85% of cases of abuse against adults with disabilities go unreported. So we just want to take a moment and think about, what some of those factors might be. People with disabilities, again, if they don't have the education around sex and relationships, might not be able to communicate what's happening. They may not be believed. A lot of people with disabilities just physically are unable to leave a situation, right? They physically may not be able to get out of a home where abuse is happening, or to fight off a sexual assault. And they may have fewer access to supports, right? Cynthia was talking about isolation, which is unfortunately, very common right now with COVID. But for people with disabilities who may have a mobility issue, they can't get out of the home easily, perhaps they're deaf or hard of hearing, and so it's hard to communicate with hearing professionals. It's going to make it a lot harder for them to get access to the services and supports that they need, and that can contribute to their higher risk. We do want to speak a little bit about domestic violence and paralysis specifically, because of the nature of the work that the Reed Foundation does. One of the components, as I mentioned, is this inability to escape or to defend oneself, so physically not able to leave, difficulty accessing external support, difficulty finding adequate personal care assistance, right? So that can be a real challenge. Even if your insurance covers personal care assistance, folks are of different quality, of different availability. Maybe they can't come to your home. Maybe this one person is the only person you can find in the entire area, and unfortunately that person's abusing you. So then a survivor may feel stuck between, okay, do I report this person? Do I try and say something, or do I put up with it because I need the help? Folks who, experience some level of paralysis are going to be more vulnerable to neglect, like a lack of cleanliness and hygiene, infections, bed sores, weight loss. All of these things can also be signals for other advocates, for friends and family, if they see someone, see someone with paralysis, that maybe there's some abuse happening, right? Why are they experiencing these infections? Why have they lost all this weight? Maybe something is going on. And difficulty communicating with the police, or if adult protective services are involved, about the abuse, right? So that could be just communication is limited because of the nature of the paralysis, or it could just be not knowing how to access these services. And particularly for folks who are relying on personal care assistance, if the assistants are in the home, right, with you all the time, and somebody shows up, the cops show up to your house, adult protective services shows up, you're not going to maybe be able to speak freely about what's happening because that assistant is right there listening, right? So we have to be mindful of that as well. And again, that's something we're particularly concerned about with COVID, because both survivors and the abusers are not going outside the home as often as they would, so it's difficult to make a private phone call. People are not coming to the home as often as they normally would be to kind of check up on you. So there's been a real lack of that privacy that survivors need to get help. So continuing our discussion about the abuse by caregivers, we do want to talk a little bit about what that looks like specifically, and how caregiver privilege plays into that. So abuse by caregivers, some of this Cynthia had mentioned earlier, so it can be withholding medical, physical, or financial support, mistreating service animals. It could be denying the physical and emotional pain of people with disabilities, right? So saying, oh, it's not that bad, you're just exaggerating, you just want to be the victim, right? So really trying to play down what the survivor is experiencing and dismiss it. Excusing the abuse as behavior management or as due to caregiver stress, right? So, oh, well, she never listens, so I have to restrain her, right? Or, I'm sorry that I slapped you, but it's just so stressful, it's so overwhelming to have to take care of you, and I just lost it, I just snapped, but I'm really sorry. Neither of those are excuses for abuse, for hurting another person. If a caregiver is under that much stress, they need to find support for themselves, but unfortunately a lot of times they'll use that as an excuse. Using medication to sedate the person for the caretaker's convenience, right? So just giving them maybe like a sleeping pill or something so that they'll sleep for 12 hours. not because it's medically necessary, but so the caregiver doesn't have to deal with them. Breaking or not fixing adaptive equipment, and refusing to use or destroying communication devices. And we have certainly seen that as well. And communication devices, it doesn't have to be anything special. It could be breaking cell phones, iPads, computers. Like Cynthia mentioned, we're all very reliant on electronics anyway, and particularly right now thanks to COVID. So damaging any of that could have huge repercussions for the person, the survivor who's being abused. So where does caregiver privilege play into this? Just a basic definition of privilege. It's a set of unearned benefits given to people who fit into a specific social group, right? So that can apply to all different types of privileges, whether we're talking about white privilege or we're talking about heterosexual privilege. In this case, we're talking about the privilege given to folks who are able-bodied, right? And that folks who are able-bodied or neurotypical are going to have more privileges, more benefits in our society. And how does this play out, right? So we often, people with disabilities often encounter ableism, right? So the practices and dominant attitudes in society that devalue and limit the potential of people with disabilities, and a set of practices and beliefs that assign inferior worth or value to people who have disabilities. And along with that is the concept of disableism, right? So if we believe that people with disabilities are inferior, that they have limited potential, then we're going to treat them in a certain way, right? So disableism is the set of assumptions and practices that promotes the differential or unequal treatment of people because of actual or presumed disabilities. So because we believe that people with disabilities are inferior or less than others, we're going to treat them poorly because we're going to say that they deserve it. So how does this play out in domestic violence relationships? So caregivers have a lot of privilege in our society, right? They are seen, because they are able-bodied, they are seen as being entitled to having certain rights, to having certain benefits that people with disabilities don't. So treating the disabled person as a child or a servant, right? This idea that because maybe they're intellectually disabled, that they're a child and that you don't need to treat them as an adult or to respect them. Making unilateral decisions for the person with a disability. Again, the idea that the person with a disability is incompetent, that they can't make their own choices. Providing care in a way that accentuates the person's dependence and vulnerability. So if we assume that the disabled person is not competent, if we assume that they can't do things for themselves, then maybe you insist that they be in a wheelchair all the time, even if they get up and walk around a little bit, right? Or you insist that they can't cook or clean for themselves. Oh no, you can't possibly leave the house, right? You could get sick. Of course, right now with COVID, we want to be cautious, but in normal circumstances, really treating the person as you're so sick, you're so dependent, you can't do anything for yourself. And because in our society, right, we have these ideas that people with disabilities are just so dependent on others, it makes it easier for caregivers to use their privilege that way. Giving opinions as if it was a disabled person's opinion. Again, our society tends to listen more to the caregiver, so it's easier for them to talk to medical professionals or police or other workers and speak for the person with a disability. Denying the right to privacy, right? So, I have to watch you get dressed, right? I can't leave you alone for even a moment. And ignoring, discouraging, or prohibiting the exercise of full capabilities. So again, if we see a person with a disability as less than, as not able to make their own choices, to make their own decisions. Caregivers may not allow them to do things, right? They may not allow them to spend their own money because they just don't understand, right? You're not competent enough to do that. Make their own medical decisions, for example. So all these ways that they may misuse their privilege to really hurt the person with a disability.
Right. Thank you so much for that, Sarah. There's some great questions coming in, and there's a lot going on in the chat box, which is fantastic. I want to address some of them, some of the repeated questions that I've seen. In regards to the slides, they will be available on the YouTube channel, which was mentioned at the top, and we'll ask that that be mentioned again at the end of the presentation. For safety planning, the next presentation is going to be going over a lot of the questions that people in the chat have around safety planning, but for the immediate, we definitely recommend you calling the National DV Hotline, which has some great resources, or our hotline, which is 212-533-4358, but that is very much New York City focused. There was a question about if a child can abuse their parent or a parent can abuse the child. So yes, we do see that very frequently, particularly from adult children. The adult child abuses their parent, or the parent abuses their adult child in these ways. There was a question about what is the best wheel to use. There's so many out there. They're all good. I've even created my own wheels with people that I'm working with so they can think about how abuse is affecting them in these different ways. So it really is a very flexible and good tool to have and use. Another question that's come up a few times is how difficult it is to hear these conversations and talk to people. Please, we do recognize that this is a very difficult matter to be talking about and listen to. So please make sure you're maintaining your own self-care in this process as we talk and listen. And the best thing that you can do for someone who is in a DV situation is listen to them. Give them choices, because often those choices are taken away from them. So whatever choice is possible, please provide it. And just be there, because the isolation is very real. It affects people, and just be there. And they know that you're there. So I'm going to continue to co-occurring disorders. So one of the most prominent is depression, and I think it's even more relevant today with COVID and people being isolated. We're seeing this more and more as people are at home and they don't have their daily routines. So a depressed mood most of the day, nearly every day. I hear a lot of people saying, I just don't have the energy like I normally do. I don't want to get out of bed. I just want to watch TV. A diminished interest in pleasure, not at all, in activities you normally would be excited about. So, for example, maybe you really enjoy cooking, and now it feels like a task to get up and make a sandwich. Could be decreased or increased appetite. I know a lot of people who are home who are cooking a lot, but they're enjoying it. The difference with this is that you don't feel like eating, you're not hungry, or you're just eating a lot. Slowing down of thought, that's an interesting one. The best way I can explain it is people tell me that they feel like they can't think straight. They just have a hard time making decisions. Their thoughts feel foggy. Fatigue or loss of energy, again, back to that hard to get out of bed feeling. Maybe taking a shower feels like an accomplishment for the day, and that could be. That you got out of bed and you took that shower for that day. But on a good day, if that was your normal being, then that would be concern. Feeling worthless or excessive inappropriate guilt. Oftentimes it comes out in a way of, I really should have done that, whatever, that one more thing. I feel like so stupid. I feel like, and they use a negative word about themselves because they didn't do all those extra things that they felt that they should have done. diminished ability to think or concentrate nearly every day. Again, back to it's hard to focus. Maybe you can't watch a TV show, you're just kind of staring at the TV. Maybe you're there in a space, but you're not really paying attention to what's happening. You're just there in the space, you feel like. And very serious is when people have thoughts of death, suicidation, or unfortunately sometimes suicide attempts. In these cases, definitely please reach out for help. This is real. People are going through these things right now, especially with we don't know what the future holds, the uncertainty of the future. There's definitely a concern in the DV world that people experience an increased level of depression during these times. So there are lots of mental health lines available to just talk. So definitely reach out for those. Some risk factors, I went through some of these. Again, isolation is the biggest one. We're already isolated, but not having your friends or family or support systems around. Limited financial resources, so if someone's abusing you financially and now maybe you lost your job because of what's going on and causes extra strain on the relationship. Low self-esteem, just not feeling good about yourself, feeling very trapped, like there's no future, you don't know what's ahead. Stress, we're all experiencing stress, but when it's really difficult to deal with it on a day-to-day. And change in circumstance, we've all experienced that the past 2 months. A lot has changed. But when you're diagnosed with something and your independence has been restricted in some way, that can really affect you and how you're feeling. So again, if you're experiencing any of these or know anybody who's experiencing any of these, please reach out for help, whether that's through your local mental health provider or a national mental health resource. And substance abuse. So this is something that we often see. So what we've discovered in New York is that apparently liquor stores are essential. So they've been open this whole time. So we have seen certain areas of substance use increase, such as drinking, because people are drinking more to help them with their situation and how they're feeling, such as numbing the pain of what's happening. So sometimes what we see, especially in these times, is that people may be unsuccessful attempts to curtail their use. So it happens. It's okay. It's fine. Just reach out for help if it happens. Experiencing cravings to use. So again, during stressful times, these are the things that we go to make us numb the pain and feel good. But what's most important is that we are aware of what the problem is and that we seek services and help. All right. So some resources, like I mentioned earlier, is the National DV Hotline at 1-800-799-7233. So they can definitely direct you to where your local hotlines are and your local resources. But of course, you can reach out to us at Barrier Free Living. Our website is www.bslnyc.org. All right. So thank you. We really appreciate you being with us for the past hour.
Yes, thank you so much to everyone. As Cynthia mentioned, there's great discussion in the chat. Folks have been asking some really great questions. Just a reminder that we are having a webinar on safety planning coming up June 4th. Is that correct, Cynthia?
Yes.
Yes. So if you're interested in learning more about how to support folks as they are preparing to leave or thinking about leaving, or even just staying safe in the situation because maybe they can't leave right now, definitely please register for that one on the 4th, and there'll be an opportunity to learn a lot about how you can support survivors.
Okay, thank you very much to both Cynthia and Sarah for today's presentation. Some really great, important information. We so appreciate it. I just also want to remind everyone that within the next week or so, we will have a recording of this webinar on the RE Foundation's YouTube channel. We will get a link out to you when that is available. That recording will have captions, and in addition, the slides from today's presentation will be able to be viewed on that recording. So please feel free to share that link when you get it with any of your colleagues or your network if you would like to do so. And if there are any questions that came in and that we weren't able to answer during our time today, we will make every effort to get an answer to you within the next week or so. Thank you again to everyone for attending. And again, just a great thanks to our presenters today. I really appreciate it.